The Foster G. McGaw Prize, now celebrating its 30th anniversary, is proudly presented by the Baxter International Foundation, the American Hospital Association, and the Health Research and Educational Trust.
We at MGH really believe that we have a four-part mission of clinical care, research, education, and community health. You could argue that community health was the first mission of the hospital. And I also believe that there's no reason you can't pursue all four of those missions with the same degree of commitment and excellence, and that's certainly what we try to do here every day.
The folks at Mass General have been genuine in their interest in improving public health in our communities. And the genuineness of interest includes listening and doing deep dives with people about what their public health needs are.
In this round of community health assessments that we did this past year, all communities were focused on substance use disorders, opiates in particular. It just shows what a devastating impact this is having on communities throughout this region.
I've been to 42 detoxes in my life. I've been to 7 transitional programs like the one I'm in now, and I've never been to a halfway house. At the point that OxyContin hit the scene, a whole generation went down the tubes. And then MGH saw what was going on in the community, and they stepped up. What it is getting down in the trenches and helping us out. You know, I've given too many mothers hugs. I've whispered in too many mothers' ears while they cried on my shoulder in the line procession at the funeral home. All I can say is sorry. And I've had 1 or 2 really good friends' moms say, at least you're still here.
To be able to give back in a community that I got high in, that I got sober in, and that I recovered in is like the biggest blessing.
She understands the hopelessness of an addict. She understands that relapse is part of recovery. And the ripple effect is now, it's breaking the borders of Charlestown. She's helping people from other communities, other cities. I believe there's hope. There's hope for Charlestown. There's hope for America. I mean, it's everywhere. You know, we're not just dying. You know, the whole country's dying.
I think for us in Charlestown was a kind of an aha moment of what you could do in building a community program. And then, you know, I am incredibly proud that it's become a model for how we now think about taking on substance use.
Mass General is committed to partnering with communities to address the social and economic determinants of health, and that really underlies our strategy. We can deliver the best clinical care, and we're proud that we do, but that accounts for only 20% of health status. 80% is attributable to, do you have access to healthy food? Are there safe places for you to go outside and exercise? And we partner with communities to address those conditions.
From last year to this year, I've lost over 35 pounds, and I directly attribute that to my participation in the Citywide Fitness Challenge. I've changed my path. I've changed my health outcome.
We're very bullish about population health management, putting in place programs to try to improve the health of a population.
Assalamu alaikum.
We work to improve access to care for vulnerable patient populations who are immigrants and refugees, people who don't speak English as their primary language.
Because our community health workers are able to create trust and they're able to do home visits and really get to know the family overall, they become trusted people to provide health education.
Because of back home, we don't have that primary care. The important things when we go into the home visit, we educate the people on how to get connected with the primary care, routinely checkup, yearly physical checkup.
He speaks Arabic, he's Iraqi. He knows everything about my culture, my religion. This helped me a lot.
And an enormous amount of this is really about partnership. It's really about how do we work in a community together with people who live in that community and care about that community to take on these incredibly important problems.
The STEM opportunities that Mass General offers to underrepresented youth are critical. And so the hospital does a wonderful job of creating opportunities for underserved youth.
My favorite thing about the STEM program is that you have someone to help you through the process of being a better person and helping in science and engineering and stuff.
Definitely thanks to this whole program, I was opened up to a whole new world. Growing up, I just didn't see myself having so many different options. I definitely never envisioned myself working for Mass General. It's been an amazing experience.
When you talk about continuity, there's been a constant, right? The constant is MGH.
We are just incredibly proud to be recognized for this prestigious award. People often think of us as a great place to get critical care, but don't often think of us as a community hospital and partner too. We really are both, and it's wonderful to be acknowledged for that.
Every day, in collaboration with numerous community partners, Mass General and its thousands of incredible caregivers demonstrates its commitment to advancing the health and well-being of its community. So congratulations to the Massachusetts General Hospital family and to all the 2015 finalists for leading the way to a healthier America. We're so proud of you.
Congratulations to the 2015 winner, Massachusetts General Hospital, Boston, Massachusetts. We also honor the finalists, Lancaster General Health, Penn Medicine, Lancaster, Pennsylvania. St. Joseph Health, Queen of the Valley Medical Center, Napa, California. Theta Care, Appleton, Wisconsin.